Hello and welcome to Medical News Update. Today we are looking at new research that strengthens the link between higher body weight and a particular type of dementia, and it also points to blood pressure as a key part of the story. The study was published online on the 22nd of January 2026 in the Journal of Clinical Endocrinology and Metabolism. It focuses on vascular-related dementia, which is dementia linked to problems with blood flow in the brain. Vascular dementia is often tied to conditions that affect blood vessels, including high blood pressure, diabetes, and heart disease. Let's review what the researchers actually did, because the method matters here. They used something called Mendelian randomization. In simple terms, they use common genetic differences that tend to be linked with having a higher body mass index, or BMI, as a stand-in for higher body weight over a lifetime. Because genes are allocated at conception, this approach can reduce some of the usual problems in observational studies, where it is hard to separate cause from correlation. It is not the same as a drug trial, but it can move the evidence closer to causality when the underlying assumptions are met. The headline finding is this: a higher BMI appeared to causally increase the risk of vascular-related dementia. In the main genetic analysis, each increase of about 4 to 5 BMI units was linked with roughly 50 to 60% higher odds of vascular-related dementia. Depending on the statistical approach used, the estimated odds ratios range from about 1.5 up to around 2.0 per standard deviation higher BMI. Two details are worth noting. First, the signal was much clearer for vascular-related dementia than for Alzheimer's disease in these analyses. Second, the researchers looked at possible pathways that might connect higher BMI to dementia risk. Blood pressure stood out. They estimated that systolic blood pressure explained about 18% of the genetic effect of BMI on vascular-related dementia, and diastolic blood pressure explained about 25%. Put plainly, raised blood pressure seemed to account for a meaningful slice of the increased risk. This is also the emphasis in the Endocrine Society press release, published on the 22nd of January 2026. It highlights the idea that higher BMI and high blood pressure are not just markers that travel together, but may be part of a causal chain leading to dementia risk, particularly vascular-related dementia. Before anyone takes this as a personal prediction, a few cautions. The genetic data here were largely from people of European ancestry, including a very large UK biobank sample described as white British, which can limit how confidently we can apply the exact numbers to other populations. Mendelian randomization also relies on technical assumptions about how the genetic variants act, so it is powerful but not perfect. So what does this mean for everyday life? Dementia is a broad term for illnesses that affect memory, thinking, and day-to-day functioning, and it typically worsens over time. There is no cure at present, so prevention and risk reduction matter. This study supports a practical message that many clinicians already stress. Keeping weight in a healthy range and controlling blood pressure are likely to help protect brain health over the long term, especially when started earlier in adult life rather than after symptoms appear. If you are listening and thinking about your own risk, the next step is usually simple and unglamorous. Know your blood pressure and take it seriously if it is high. If you have obesity, ask for support that is realistic and sustainable, which may include structured lifestyle help and, for some people, medication. None of this guarantees that dementia will be prevented, but the direction of travel is consistent across brain and heart health. What is good for blood vessels tends to be good for the brain as well. That's it for today's medical news update. If you want to read more, the full research paper is in the Journal of Clinical Endocrinology and Metabolism, and the Endocrine Society has a short press summary that walks through the main points in plain language. If you found these insights valuable, please subscribe and share this podcast with others who care about metabolic health. We'll return next week with more breaking developments from the world of health research.